I'm one of the staff members at IMCES, the Institute for Multicultural Counseling and Education Services. Our community clinic is reaching out to the community to inform everyone about the coronavirus in a simple way. I'm going to show you how this virus affects us and what we can do for protection. This is the coronavirus. You probably have heard about it. He's been around since the end of 2019 and has changed our lives. In real life, coronavirus, or COVID-19, is a virus, a very tiny organism, so small that it is invisible to the eye. You know, like the flu that is also a virus. These organisms enter our body mainly through our mouth, nose, or eyes, and they find a comfortable place in our bodies to reproduce and spread. Same as the common flu, coronavirus produces uncomfortable symptoms like fever, cough, breathing difficulties, sore throat, nausea, diarrhea, loss of taste or smell, body aches, and others. Even though everybody can get infected, elderly people usually have more problems because their bodies can't resist as much as younger people. What we know from reported records of illnesses is that people can have different reactions to the virus. Some have mild symptoms, and some get so sick that they need to be treated in the hospital. Coronavirus can be transmitted from one person to another very easily, just touching infected objects or surfaces and then touching your face. Or also by the tiny droplets that come from an infected person when he sneezes. Being close to a person with coronavirus puts you in a big risk of contagion. Big health organizations and professionals have given us recommendations to avoid getting coronavirus. This is what you can do. Practice social distancing. This means to avoid crowded places. Stay at home if possible, and if you need to go out, maintain a distance of at least 6 feet from others. Wear a mask when you are not home. In some places, this is even enforced by law. Wearing masks reduces significantly the rate of infection. Wash your hands thoroughly with soap as often as possible. Our hands touch hundreds of things every day and can transport the virus to our respiratory system. Washing our hands often is one of the best ways to avoid getting infected. For the same reason, we should avoid touching our faces. It's also important that we educate others. Many people still don't know what to do, and some others have wrong information. So spreading the word about these simple recommendations can help others and even save lives. It's important to make the people around us understand we care for ourselves, not only to be healthy and virus-free, but also for them so they won't get infected. But you shouldn't be scared. There are hundreds of professionals working on getting rid of this problem. They will continue giving us direction and working on a vaccine to once and for all remove the threat of this virus. Several big pharmaceutical companies are working day and nights to create a vaccine. They're almost finished testing them, and very soon they will be able to make it available for all of us. But for now, we have to be alert and disciplined. I encourage you to follow these recommendations carefully and be optimistic. We all need to work together so we can defeat coronavirus.